Now, I'm a mobile vet, not a veterinary dentist. But sometimes you meet the right person and the right pet that makes you jump out of your comfort zone.
Yeah, her teeth are very bad. Her whole one side, she can't even chew. She can't, because her teeth are literally, they're coming out. I'm hoping that in the future my little girl will have her mouth fixed. Before I lived here, I lived for 2 years in a rooming house. And a rooming house, as you may well know, is just a small little room with nothing else. And I have a very hard time keeping things tidy because I have a disability. Well, it's called executive functioning, if you know what that is. So it means that keeping things organized and clean has always been and will always be extremely difficult for me. So living in a really tight space, it's hard. It was really, really hard. So I did not want to bring her into that environment. So I left her with my mom, and when I got her back recently, it's only been a couple weeks now that I've had her, I've noticed that her teeth have become drastically worse than they were when I used to have her. And I'm guessing that's just partially an aging thing and partially a lack of care thing. And her mouth has been very smelly for a very long time.
When you walk into the room, all we could smell was the decay of Mia's breath. Elliot's done her homework. We're going to do an exam and see if we can confirm what Elliot thinks is going on for Mia. I'm actually hoping it's bad teeth and not a tumor or some other problem that she's dealing with. Teeth, more or less, we can deal with. Tumors in the mouth, that's a whole other situation. I'm looking at your nose. Any discharge from there? I think her eyes look better than mine do. I've got some eye issues right now, and hers are looking pretty healthy to me. She's got some normal age-related changes there, but nothing bad. Lymph nodes are good. I felt all those bumps as I put my hand down on her. Yeah, I'm gonna take a big guess right now, and I'm gonna call these sebaceous adenomas. Am I right? I'm right. Like most people, Elliot was concerned about the lumps she found on her dog. Those lumps, not looking too bad at all, so let's move on. Regular rhythm, no murmurs. I couldn't find your heart. It's like in this barrel somewhere, in this barrel chest. Elliot knows she's pleasantly plump. She's got some J-Lo booty. She's working on it. The reason I put on gloves isn't because I don't like her. The reason I put on gloves is we never know what we're going to find inside of a mouth. Elliot has identified correctly that we probably got some dental issues going on there. We could find pus, abscesses, those sort of things. So we use gloves just to make sure we're not transferring anything to her and vice versa.
Good girl.
Watch when her tongue moves. Even the gentle pressure of her tongue on her tooth is enough to make that tooth move within its socket. So Mia is just living with this widespread decay in her mouth, day in, day out. She can't ever escape from it. More loose teeth, gum recession, inflammation, probably periodontitis. Don't see any tumors, which is a good thing, but everything else is pretty messed up. See that white line amongst all the brown, green, calculus, and tartar? Well, that could be infection. Let's take a closer look. We bring equipment and special stains to our appointments. We pick a spot in someone's house and process the slides. We hook up our microscope to our laptop so people can see exactly what we are seeing in real time.
Just using a regular Q-tip, get right in there. Oh, I know, baby. So we're gonna dip it through these 3 sets of stains.
Look how pale you are compared to me. It's like this magnitude.
I look so pale.
Look how pale you are. Oh my god.
Hashtag pasty white cloud.
Yeah,
okay, we're seeing so much rods in here. We're actually seeing chains of rods. And some cocci actually it looks like there's small amounts of cocci in here as well.
This is the amount that you would see in an abscess,
Yes.
right?
Yes.
This is the amount you would see in an abscess, except we got it from the mouth,
Yeah.
right? Instead of like a cat abscess on the butt, because they got upset and they were fighting.
Yeah.
You could see on the microscope all those bacteria, right? Moo has high potential to have abscesses like all throughout. And so dentistry is the number one thing that needs to happen. And I would say it's not even just like a dentistry, it's like a dental surgery.
Yeah.
You got it, right?
No, yeah.
When we do a dental surgery, the first thing we gotta do, because it's gonna take a little bit of time to set things up. What's the first thing we've gotta do? The first thing is always comfort and relief first. And what that means is we've identified lots of bacteria. We're very interested in what we're saying over here. You're part of the family too. That's right. You're gonna see if you approve of this. What we're gonna do is this. Very first step is I want to give an antibiotic. And the type of antibiotic I want to use is something called antirobe. It's also called clindamycin.
I've had
Thank
that.
you.
I've taken that myself.
Thank you. Clindamycin.
Yeah, I was gonna say that. I was
Yes.
gonna say it too, but no, I've actually taken that before my rat bit me.
Oh.
And that's what they put me on.
Dentistries are expensive, hey? Like they're really costly, and so what we're hoping to do is go like animal welfare first. Animal welfare just means like freedom from like fear, pain, anxiety, or suffering, basically. And so like we want that to be first. And bad teeth can cause all of those things. And so you know, as long as you and I are on the same page, and what that would be is take out the trash, take out the garbage. It's like we're overflowing with stuff in there that's poison. Remove the poison. What do you think about that plan? If Tara and I find a place we can go that would allow us to use their dental ward, basically.
Yeah, that sounds great. And I'm pretty comfortable and happy with the idea of her being able to maintain some teeth. And you know, that's such an important function for dogs, for just their whole mental well-being and everything. Chewing is just, it's so natural to them.
When anesthesia is involved, people feel anxious. When surgery is involved, people feel anxious. When you're separated from your dog or cat, you can feel anxious. Now imagine all of that combining together with an executive functioning disorder. Elliot showed up at the wrong hospital, and then her cell phone died. The kind people at Carling Animal Hospital directed her back to us, and she eventually made her way to West Carleton Animal Hospital, who donated their dentistry bay so Tara and I could do our thing. Some panting and hypersalivation probably means she's a bit anxious, so we start off with a pre-medication that's going to help her calm down and make her anesthetic balanced. We place a catheter and IV fluids. We then get ketamine and Valium, which is her induction agent. The induction agent is a short-acting anesthesia. She gently drifts with no stress in a very calm way. And it keeps her under long enough so we can place an endotracheal tube. This tube supplies isoflurane, a very controllable type of anesthetic that keeps her under during the dentistry procedure and protects her airway so fluid, blood, all the stuff doesn't get down into her lungs. We begin by taking out the trash. We've got to remove all that material to see what we're actually dealing with underneath. Tara scales the teeth to further clean them up, and we make note of what's there, what's missing, and certain measurements that we want to know about. Some of these teeth are so rotten that they're hanging on by a thread. I'm making this look easy, but in reality, many teeth are much harder than that. For most teeth, it's a process of patience. Drill, elevate, wait. Be patient. Don't snap roots. This is before. Pain, infection, odor, inflammation, and this is after. A lot of those teeth are gone, the ones that are remaining look functional and good. Dental x-rays are performed, so we know that we've gotten out what we needed to take out. With the right anesthetic technique and pain control, recovery can be very smooth. As we clean up the dental bay, we let her look around, have a chance to relax a little bit. Then we return her to Elliot.
Right here, lie down there.
We go over her pain medication, her feeding routine, and then she's off. Dentistries can be a night and day experience. You go in with unbelievable infection and pain, you come away with absolute relief. You can see it. After 2 hours of anesthetic, look at the spring in her step. If you like what we do, subscribe. It helps us help other people just like Elliot and Mia.